talking too much this week. Your voice does get worn out from talking too much, I'll tell you that. All right, so we left off on that routine essential projections of an abdomen series, and if you remember, that's typically going to consist of your supine abdomen, also called a what?
AB.
What's the supine also called?
KUB.
KUB, which stands for what?
Kidney, ureters, and bladder.
Kidneys, ureters, bladder, not urinary, ureters.
Oh.
And that's going to be a synonymous name of the two. And your AP upright and your PHS upright. That's your routine or essential projections. Most of the abdominal series you do will follow this format right here. We also have some alternatives. So this will order what's called a two-way abdomen, not including the chest. And that's going to be your supine or KUB and your AP upright. Now for both procedures, registry question right here, guys. Registry question. A left lateral decubus abdomen is always performed in lieu, which means in alternative, of the upright if the patient cannot stand up. And that will still show you those fluid and air levels, just like an upright abdomen would do. That's your alternative when the patient cannot stand. Left lateral, and left lateral decubus only. You remember why dysphonia said that was important? What was the reason for that? So the air will rise properly and not get hung up on the other organs in the body, correct? So you must do a left lateral. And that's just a note there again, guys. It depends on the institution how they're going to order these abdominal series. Like I said, the most common way I've seen is three-way. We got the chest, upright, and the supine. But some will opt for this two-way as well. It just depends on what facility you're working at and what their radiologist preferences are. Next, we're just going to start breaking down these projections, of which there aren't very many, as you guys saw from lab this week. Much less selection overall. Real easy to remember, I hope. Calm before the storm, though, guys, because the preview next semester, the first chapter has like 20-something projections.
Oh my goodness.
You're rated in lower note this semester.
You should have saved that to the end.
Well, you know, I like to be transparent.
Trying to scare us away.
I like to be transparent. What did you say?
I said one of the seniors over here in the back, he told me to start studying like everything from the next semester now.
Very wise words. All right, of course, the first and the most popular, guys, with your AP abdomen supine, once again, also called your KUB. Now, the supine, if you're going to do an abdominal series, and the only one you can obtain is one of that series, and the supine is always preferred over your upright. It's because your ideal, almost a chest x-ray, your ideal abdominal x-ray. But once again, most of the time, you're going to go ahead and perform that upright as well, because they are looking for those air fluid levels. So how are we going to position, guys? Of course, MSP for the midline of your grid. So your crosshair, that vertical line of your crosshair needs to line up with your MSP, going straight down the body. You do want to support the patient's knees. As we know, and all of you being patients at this point, practicing in lab, those tables aren't the most comfortable. And if you're laying on a hard table, especially if you're sick or in pain, what are you going to naturally do? Shift your weight. If you're shifting your weight on your hips, what's going to happen to your x-ray? It's going to be rotated. And we want to avoid rotation. So go ahead and have the patient bend their knees or put a support or pillow under them. It'll help them be a little more still for you. We must ensure the pubic symphysis is included on our supine abdomens. Now, you're going to see alternatives at clinic. Your techs are not going to do this. They're going to send these in. Per the curriculum and per what we call quality imaging, and please do this when you become a tech, if you're missing that symphysis, you must repeat that radiograph to include the symphysis. That is important. That's also a registry question. We'll try to trick you on. Assuming techs do not do that. For your tall patients, a lot of times that symphysis will be clipped because a tall, skinny patient, the abdomen is going to be a lot longer. You do what's called a bladder shot. And that's just going to be a lower pelvic type x-ray to include that pubic symphysis. Make sure that bladder's on the film as well. Even though we can't really see the bladder, we want to include it in case there's any kind of issues going on in that area of the body. Our IR and our central ray, of course, center to our iliac crest. We get used to covering those crests this week. Are we still having a little trouble finding those crests? Is it getting a little easier? Did y'all find the crest or the as is?
The as is.
The as is, that's what gets people, is that as is. Make sure you're cupping the top of that crest. If you are not, you'll end up being too low on your radiograph. You want to make sure you're nicely centered. Yes?
I have a quick question. So to find the iliac crest, do you think we we should palpate at an angle.
You want to palpate right on the side and dig your hand in on top.
No, but to find it, you know,
Like
is it
this?
easier like to cut at an angle or just straight?
Just straight.
Straight? At an
If
angle.
you go at an angle, you're going to risk it as is. Straight's going to be better. All right, once again, guys, perpendicular to the IR, level the iliac crest on that central ray. Keep in mind, also with your hypersthenic patients, does that mean the patient's very wide or very skinny? Very wide.
Wide.
We're not hypersthenic, trust me. Hypersthenic is going to require at least 2 crosswise projections, sometimes more. I've had patients so large they required 4 x-rays, all 4 of those quadrants of the abdomen to get it all on there. And once again, your tall, skinny patients, your more asthenic patients, they may require that separate bladder image to make sure you're including that pubic symphysis on film. So once again, those body